I think I want to talk about wellness. Let's talk about wellness. We'll talk about some wellness in my PJs. Because, no, nobody here yet. How's everybody this Sunday? Oh, somebody's watching. Can you let me know if the audio and visual is non-buffering, please? Is it okay? Five out of 5 good feed. Awesome. Thanks. Look at these books I found. I'm sure we can find some interesting information in these books. The first title I wanted didn't really jive, I think, with the algorithm. So we're going to talk about wellness. All right, so let's see if we can maybe get the books on wellness in the frame here so we can do a little preview of what volumes of knowledge I'm referencing from. If you would. It's a Leaning Tower of Pisa. Hi, Peyton. Okay, please promise me if my audio or visuals gets buffering to please notify me in the chat so I can move. Thank you. So I wanted to talk about Justin Biebs and the current situation. I am in my pajamas and drinking my coffee, but I do want to preface this that I do have a license to practice medicine in the state of California. I am a physician assistant. I went to Samuel Merritt University. That's in Oakland, California. See that? You see that? That's me. So I got these like books from when I went to school, and you know, like all of this like was supposed to go in here, and then I like used that information to treat people's diseases and illnesses and prescribe medications. So I do have authority over any type of, you know, YouTube guidance based on medical information. Just prefacing that. But we're going to talk about wellness, and I'm going to read some excerpts. We're just going to like flip through like what the differential diagnosis would be like according to these books. I'm just going to read these books that I have. They're like official textbooks from a long time ago. So there's probably new additions, probably new information that this is like outdated. I want to say this is probably outdated information. Okay, so I'm just reading this. You know, I'm just reading it like, and I just thought it was interesting today how people are like analyzing computer images, you know, because it's funny like how people can like be reviewing like facial features and like trying to apply like a cartoon as having some kind of human illness or wellness, because I've personally seen people in my profession as a physician assistant. I've seen people and treated people, multiple people, with facial paralysis and different problems. And like when you can't blink your eye, it's really irritated and it gets all red and inflamed, and you have to give them these special eye drops where they have to constantly be dropping the eye drops in their eye, and usually they have to have sunglasses because their eyes are so sensitive to the light because their eyelid can't cover it's called the globe of the eyeball. The eyeball's called the globe, and when you can't blink due to certain facial nerve paralysis, you get extremely dry, so you have to have like constant eye drops. And then it's like running down your face. It's like you're constant, like this whole face gets droopy and inflamed and red and usually swollen. So there's like a big disfigurement kind of look to the person when they're suffering from something like that. And again, usually they have to wear sunglasses because just any kind of light is actually really painful. It's called photophobia, or yeah, it's extremely painful and causes them like nausea, so they can't really like focus on people or on cameras. So I just thought it was interesting because some of the images I've been looking about people talking about wellness and certain problems they've been having in regards to wellness, they kind of look like computer images because it's like so perfect, you know, like people that have problems with wellness, usually they don't have like really good symmetry. But hey, like let's flip through some of these books and see what they say about what happens if like something happens with your face and it gets paralyzed, because maybe I don't know what I'm talking about and I'm just like remembering it wrong. So I'm gonna look it up. Look at like there's like cool pictures in here, see? This was kind of before you had to rely on online sources for your information, because it seems like a lot of times online information can change, you know, but maybe that's just me being like overly picky or something. All right, so I'm gonna look. So this is emergency medicine, so you have to think, all right, so what would the person come into the emergency room complaining about, right? You can't like just look up a diagnosis. Like you have to first like investigate, right? Like you're a detective. So person walks in, what's their problem? I can't move my face. Okay, facial paralysis. Let's look up facial. I see facial pain, facial infections. Facial disorders. Oh, herpes zoster. That looks interesting. Let's look at that. That's listed under facial infections. Herpes zoster in this book. Oh, cool. And look, I see something interesting. It's called RAM, C, like a ram, like a goat, and then a sea, like the ocean, and then like a hunt, a ram, a ram, and a C, and then a hunter syndrome. And that's caused by the thing that causes chicken pox. That's called zoster. And it goes into the trigeminal nerve. Involvement of the ophthalmic branch, which is branch 6, especially with vesicles on the tip of the nose, indicative of involvement of the nasociliary branch, is a serious concern. So usually you have ophthalmic involvement, which is like your eyes. If you have actual chicken pox blisters on your nose, the thing may spread to motor root ganglia, resulting in motor weakness or paralysis. The ram sheep thing with the sea ocean and the hunter results from facial and auditory, which is your ear, nerve involvement. The cutaneous, which is the skin, eruption consists of zoster lesions in the external ear canal and on your eardrum, which is called the tympanic membrane. Bell's palsy and possible deafness or vertigo may result. So that's like feeling like you're always falling down or you're dizzy. Oh, look, they have a picture of this type of syndrome we're talking about. So if you have the sheep, the ram sheep with the ocean sea and the hunter, your ear is supposed to look like that, because it's so swollen that it presses on the nerve that is supplying the muscles that open and close your eyelid. So usually your whole side of your head is swollen up like that. So I just thought it's interesting that these computer images talking about wellness problems, they don't look like that. They look pretty, normal. Just one looks like a computer generated thing doing like this. I don't know. Do you guys see what I'm talking about? Michelle, no. Hi, Frank. Well, I'm not a nurse. I'm a physician assistant, so that's the same level as a nurse practitioner. So I have a master's degree. And I could, but I couldn't. There's still requirements right now to get reimbursed by Medicare. It's constantly changing. I haven't, I always get calls by recruiters and stuff, but for hospital, is my picture okay? But for hospital jobs right now, they pretty much are going to no sound. No audio, no sound. Can you guys hear me okay? Is Kate telling the truth? Can you? Yeah, certain states are different. So if I wanted to move states, but I would have to get relicensed. Okay, thank you. Thanks, guys. I think things are going to change real soon based on the need. This is not a signal, sorry. It's like a bad habit, like we're trained to like just start touching our faces when we're thinking. What was I saying? I think things are going to change pretty soon because they're going to get desperate, but my everything is still valid in regards to my credentials and my licensure. But as far as I know, if I didn't get certain medical procedures right now, I can't get reimbursed by Medicare, but I guess I probably could find positions maybe in private pay, like concierge medicine. But yeah, so let's look at another book and see what it says. Maybe a pathophys. Let's try the pathophysiology. See, if you guys didn't see, that's where I went to medical school. In Oakland, Lake Merritt. What? Woo! Go Warriors. Golden State. Sorry. This is called Pathophysiology Concepts to Altered Health States. So basically, this is a book on wellness. I like to collect books on wellness because I have a master's degree in medicine, and they were requirements to get the knowledge of these books. I had to pay lots of money to learn how to help people and prescribe them the best treatments. But I am currently not making money doing this. Oh. I opened right up to the V page. Interesting. What are we going to look up? The pathophysiology of, let's see if they actually have that sheep syndrome listed. How's your guys' Sunday? Did you guys think that some of these images were computer generated? And people like, I love how like people are just like their own, you know, everybody wants to be a doctor, you know, everybody wants to like learn the science. And now you can just like Google it and you just know, you know? Isn't that funny? I've noticed though that like Google doesn't always get it right. Like it doesn't get it right a lot of times. It maybe got it right back in 2012. Like you could Google something and it would get it right. But now, I don't know. It seems like it kind of tells you what you want to hear. Like, yeah, some people think they can just like get a medical degree on YouTube or something. Like, that's awesome. And you know, by all means, if you want to take medical advice from people on YouTube, I mean, everybody has their right to do that. I don't think they actually list the sheep, the man sheep. So let's look up the pathophysiology of the zoster. The zebra. Did you know in medical school, they call rare illnesses or rare presentations of syndromes, they call them zebras. And when you're fresh out of medical school and you're in your new job or you're in your internship, you have all of those like weird diseases that you learned about and studied about in your head. And you go into the emergency room and you see your first patient and you're like writing down all of their problems, and you write down like, oh, they have depression, oh, they have a cut on their foot, and blah, blah, blah. And you go to the doctor and you're like, okay, I have this 38-year-old man, homeless, who presents with a laceration on his right foot, depression for 3 years, and a history of substance abuse, intravenous and methadone pills. And a differential includes blah, blah, blah. And then you say, I think he has a syphilitic brain lesions that are causing him acute paranoia. And then the doctor goes, that's a zebra. Like, you think of like the weirdest thing first. And they say, oh, it's usually the most common thing. But I actually diagnosed a lot of zebras, including disseminated aspergillosis in a lady from Taiwan who was treating her ear infection with herbal Chinese medicines, which are actually like ground up bear gonads or adrenal glands, and they're like steroids. And so when you take high-dose steroids, it reduces your immune system, so you get really bad infections. So she had disseminated fungal balls. She had like mushrooms growing in her arteries, and we had to take her to the operating room, and we were pulling out these like giant, fluffy, like mushroom things out of her aorta and like out of her femoral and iliac arteries. Like we were pulling, like threading a Foley catheter balloon and then inflating it and then pulling it back, and there was like all of this like chunky mushroom ball fungus, and like nobody knew what it was. And I was like, I think it's aspergillosis, because on her chest x-ray she had it's like a what do they call it? It's like a it's not pathognomonic, but it's like it's like the characteristic sign of aspergillosis, which is this fungal ball. It's like a hollowed out ball at the tip of your lung, where the fungus grows, because it doesn't have a high oxygen content at the tip of your lung. So that's where the fungus grows, and then you get like a hole right there. And that's where she had her, like the hole on her chest ray. Nobody knew what it was. I was like, I know it's aspergillosis. And then we went to the pathophysiologist in the hospital, and she was looking at the fungal clots that we had pulled out. Like the surgeon, my mentor, my boss, thought it was like white. It wasn't blood clots. It was like this white fluff. It looked like styrofoam. And I was like, it's mushrooms. Like, it's mushrooms. And this was like a 2-day surgery. It was like a 9-hour surgery I was in with. And after we were pulling out the mushrooms out of her aorta, like we had all of her intestines on my side of the operating table. Like, I'm on the bad side of the operating table because I'm like retracting, because we had to do like an open belly cut down on the aorta. And after we did that and sewed her all up, then we had to, she had clots in her brachial artery going down to her hand, so her hand was turning blue. So then we had to open up her arm, pull out the clots in her brachial artery, and then send balloons down into her hand and pull out little clots out of the arteries in her hand to restore blood flow to her hand. Oh, it was a mess. But then we get to later to the lab, and the pathologist is looking at the clot, and she's like, I'm like seeing these tubules, like these microtubules, like all it's like these like tubules. I don't even know what it is. I'm like, it's hyphae, isn't it? I was like, it's hyphae. And she's like, hyphae? Like, yes, it's fungus. And then Dr. Mahegan looked at me, and he's like, people started calling me House after that, like in the hospital. This is a true story. Yeah, it was mycelium. It was, and then they were like, it was disseminated aspergillosis, and it was because she was taking high-dose steroids, which reduced her immune system, and she was traveling between the Bay Area and Taiwan, and she got this really bad ear infection. So I'm gonna look up herpes, the herpes. Yeah, people with these problems with their face, they look tore up. They do not look pretty. They're like droopy. They're like mucousy. Like if the eye can't blink, you have to like constantly be dropping eye drops in it. Anybody that has been around somebody with conjunctivitis or Bell's palsy knows, like, those people are effed up. They are miserable. They look miserable. They look like they were in a car accident. They're so messed up. They're usually like vomiting a lot. And usually there's actual like things going, little blisters. So it's, and what I'm saying, it's probably not wise to try to diagnose something that's made in a computer. You know, like if it's a computer image, it's probably no point in trying to look at it and see what's wrong with it, because it's like looking at it like a painting, you know, like a cartoon. They can do whatever they want. Okay, herpes zoster, neuralgia. Yes, this is what we want. Okay, we got 2 spots. 1182. Do you guys want me to read the part on neuralgia? Trigeminal neuralgia, herpetic neuralgia. This is supposed to be what the Beebs got. All right, well, this is more pain, not paralysis. Yeah, usually as like a shingles, it's extremely painful. Like anything brushing the skin, it's like the most horrific pain for the person. Okay. The pain associated with acute herpes zoster and post-herpetic neuralgia. So that's like the first infection of chickenpox or shingles, and then the pain that is afterwards results from injury to the peripheral nerves and altered central nervous system processing. There is inflammation of the dorsal root ganglion, hemorrhagic necrosis, and neuronal loss. There is a proportionality greater injury and loss of large nerve fibers, and regenerated nerves tend to have a smaller diameter. After injury, the affected peripheral nerves discharge spontaneously, have lower activation thresholds for discharge, and display exaggerated responses to stimuli. So after the infection, the person is a lot more like, they'll have spontaneous movements, like tics, and they will have a greater response to like light or touch. Because there is a relative loss of large fibers with age, elderly persons are particularly prone to suffering. This is usually an infection of the elderly. Like old people get this because as they get older, their immune system goes down, and then the thing wakes up in the nerve. That's the theory. Normally, the pain of acute herpes zoster tends to resolve spontaneously. Post-herpetic neuralgia, which is pain, describes the presence of pain more than 1 month after the onset of that thing. Early treatment of shingles with high dose of systemic corticosteroids and an oral anti-V drug, such as a cyclovir or valacyclovir, which is Valtrex, medications that inhibit herp V DNA replication, may reduce the incidence of post-infection pain. Initially, the neuralgia can be treated with a topical anesthetic agent such as lidocaine or lidocaine with prilocaine. A tricyclic antidepressant medication such as amitriptyline or desipramine may be used for pain relief. Regional nerve blockade, i.e. stellate ganglion, epidural, local infiltration, or peripheral nerve block, have been used with limited success. Topical capsaicin preparations, which is capsaicin is what's in hot peppers. So a lot of times people with pain problems or long-term opioid abuse or opioid resistance to pain medication, you start relying on like topical medications. Like Bengay has capsaicin in it. That's that tingling that kind of redirects the pain response. So you reduce the pain because you interrupt it with that tingling sensation. That's capsaicin that comes from hot peppers. Okay.
Virginia was actual barnacles. Hey Maggie! She's just reading medical books. Hey Bokarek!
Because we're talking about computer images of the Beebs and people using computer images to diagnose wellness, I'm using codes because when I use the actual name of the sheep, like a male sheep, like a ram, like a ocean sea, like a hunter, that has to do with the Beebs, it didn't go up. So we're kind of coding words right now, and we're looking up my wealth of non-internet sources, and I'm talking about my own personal anecdotal experience with people treating patients with I've treated ophthalmic herpes, and that person had PTSD, active herpes, and they were being activated by the fireworks in the area because they had PTSD from Afghanistan. So it's very stress related. But those people are effed up, and it's like it's an eye emergency. They have to be followed very, very closely by an eye doctor. But you need constant eye drops, and they need like dark sunglasses. All right, we're gonna look up that other reference to the zoster. I'm just saying, like, the whole thing is kind of silly. I know I'm kind of like putting up things on my community page, but it is a narrative that they are selling, and I don't think a lot of these people that are dropping are even real people. At least the images that they're presenting to the public are not real images. They're heavily, I think it's all computer. I mean, you could say, oh, it's a filter, but somebody that has that actual problem doesn't look like that. Like I said, they're swole up, their eyes like watery red. They have like conjunctivitis on top of it. Usually their ear is swollen with blisters. Okay. Neuropathy. Oh, Guillain-Barré syndrome. Yeah, so the, okay. 14.
So usually the syndrome that the Beebs was talking about would affect the nerve that controls the musculature, the motor control of the eyelid, comes around the ear. So usually there's blisters in the ear, and it's so swollen that it affects the nerve. It could be either just like the inflammation itself is compressing the nerve, or like they say that this thing lives inside of the nerve and wakes up, and the actual nerve itself becomes inflamed. All right. Varicella zoster ophthalmicus. Herpes zoster shingles is relatively common infection caused by herpes virus type 3. Same thing that causes varicella. It occurs when the chickenpox thing has remained dormant or sleeping in the neurosensory ganglia since the primary infection is reactivated. So a ganglia is like a central hub of nerves, like it's where a bunch of the bodies, like the nerve has a body, and then a long tail, which is the axon. So the nerve, the way the message comes in, it comes in through the dendrites, the little branches. The message comes into the branches, into the body of the neuron, and then the message goes down the tail, the axon, into the axon terminal, into the dendrites of another nerve. But a lot of times the bodies of nerves are all kind of located together in a ball, and then their tails are kind of coming out of it, and that ball is called a ganglia. We have like a ganglia here, and people will get what do they call it? Ganglion cyst, right, on their wrist, and then the only way is that you like smack a textbook on it, right? So the herpes in the eye, which represents 10% to 25% of all cases of herpes zoster, occurs when the reactivation of the sleeping thing occurs in the ganglia of the ophthalmic division of the trigeminal nerve. Immunocompromised persons, particularly those with the human immunodeficiency problem, was it the are at higher risk for developing the herpes zoster in the eye than those with normally functioning immune systems. So this only happens in people with really low immune systems. People with low immune systems are people that are on chronic steroids. What kind of people are on chronic steroids, taking steroids for their whole life? Maybe it's because they know that they were born in the wrong body. They know like deep in their heart that they were born in the wrong body, so they have to take steroids to make their mind match their body, or what they think. So they're prescribed steroids to reverse their either XX to X, like they want to phenotypically change what the looks are. You can't change somebody's DNA from XX to XY or XY to XX, but you can change the look by taking steroids. Yeah, so there's a lot of people that take these medications for a long time, and the side effect of taking those kinds of things for a long time is that it lowers your immune system. So like your body won't fight itself. You're like making it so your body won't fight itself, so you let that change happen. You also don't let your body fight like invaders. So if you have like dirty skin or you know, if you have a lot of stress, then you'll get those like eruptions of problems, and things gets really swollen. So that's something that people don't really think about. What these people taking these medications for a long time, their immune system is really, really harmed, and they get lots of medical problems, especially later in life, like in their 40s and 50s usually. But that's anybody that's taking steroids, like people with asthma or people with like advanced COPD. They need to be on bronchodilators or corticosteroids. People that like get like knee injections, corticosteroids in their knee, they're way more prone to knee infections. Anytime that steroids are introduced, it's going to lower your immune system. And that's the goal of steroids most of the time, is that you were giving the steroids to lower your immune system because you're trying to reduce that swelling. Like you're giving steroids for a lung infection because they're trying to lower your lungs inflammation, because your lungs responding to get it gets puffy, it gets filled with fluid because it's trying to flush out the problem. It's trying to flush out the problem. So you get the mucus, you get full of fluid, and you go to the doctor, and the doctor's like, we'll treat the problem, we'll treat the fluid, we'll treat the mucus, and I give a steroid, and that dries you up, and then you kind of feel better, and it makes you feel better. Steroids make you feel really good because it lowers any type of response your body will give to protect itself, because usually those responses aren't pleasant, like to you, the person, like getting mucus, like a runny nose or like a sore throat because things are swollen. That's not pleasant. So instead of like letting your body kind of surf through and let it puff up and flush it out on its own, you lower the puffiness, you lower the mucus by taking a steroid, but that just allows whatever problem to keep on manifesting, and you have to kind of deal with it later on, or you have to keep on taking the steroids to keep on making that mucus not come back. So a lot of times these infections can build up over time because they're never quite fully treated. It's a Frankenstein's monster snowball from hell. The herpes zoster in the eye usually presents with malaise, which means you feel bad, fever, headache, and a burning, itching sensation of the periorbital area. So this area itches or is very painful. These symptoms commonly precede the eruption by 1 or 2 days. So usually you get these fever and headache before you get the blisters. The rash, which is initially vesicular, becomes pustular and then crusting. So first they're like fluid-filled sacs, like blisters, and then they become full with pus, and then they pop and get crusty. So I didn't see any of that on that computer image. Involvement of the tip of the nose and the lid margins. So it would be like here. Indicates a high likelihood of ocular involvement. Ocular signs include conjunctivitis, keratitis, and anterior uveitis, often with elevated intraocular pressure. Persons with corneal disease present with varying degrees of decreased vision, pain, and light insensitivity. Treatment includes the use of high-dose oral anti-V drugs like Valtrex. Initiation of treatment within the first 72 hours after appearance of the rash reduces the incidence of ocular complications, but not the post-herp nerve pain. Are there any new thoughts? Hi, Daniel. On the cause of Morgellons disease. I think it's us just pushing foreign bodies out. Anytime you have foreign body in your body, if it's not surgically removed, your body will either encapsulate it, it will make a cystic structure, like a bubble around it, and then kind of push fluid around it so that it kind of becomes its own thing, and then it might stay there forever, or your body just kind of slowly absorbs it. Or what normally happens is your body will just slowly push it out to the surface. So like, I don't know, like a lot of times like kids will push like lead pencils into their hands, and then it just takes time for it to get pushed out to where you can dig it out, or like splinters. So that's what I think that, and even like leftover, like surgical gauze and stuff, a lot of times the body will actually push that out to the surface to where like you can pull a string out and like it keeps coming, like that kind of stuff, or like stitches that are left behind. So that's what I kind of think that is happening with the Morgellons, is that your body's pushing the fibers to the surface. I also kind of like thinking that it might be like it's like a nanotech pinworm. That's they're kind of operated with electrostatic. They're like they're like tubes of air, but it's like positive charge, negative charge, positive charge, negative charge, like discharge, relax, discharge, relax, and then like that's how it kind of it fills up with air and then squirts it out like a little jet siphon, and then it also uses static electric. There must be like a different, maybe like a head tip, like a magnetic tip that uses static, but I think our magnetics are changing, and that's like repelling the fibers. It might be the graphinetic type. I'm not gonna say the word. I probably already just like trashed this. I'm just reading books. Yeah, so yeah, there's the motion of our blood pumping. It's not like a it's not a continuous stream, right? It's a pump, and it's a lub dub, and there's also a contraction of the arteries themselves. So it's like a like if you look at like videos of blood moving through capillaries or arteries, it's like it's going, and then there's this pause, and it kind of like goes like this, and then so there's eddies, is flow, and this creates a current, and anytime you have a current, you create a magnetic field, right? So we're pulsating this magnetic field, right? And then when you change the properties of the blood, like the iron content, if you're anemic versus not anemic, that will change the magnetic properties of your auric field of your actual body, based on like the amount of iron, if it's still moving in a circuit, if it's a like a predictable circuit, like it's always flowing in the same pattern, in the same way. You don't have like a clot in one arm that like sometimes squirts blood through and sometimes it gets stuck. And so like when a woman starts her period, like a lot of blood flow is, you know, redirected to the uterus, and she can get dizzy, lightheaded, because first of all, you're losing blood, but also like a lot of that like energy is being focused to contract the uterus and like infuse fluids to flush out the system, so you can kind of get dehydrated, you can get like dizzy, but that like changes the magnetic force of the actual woman person when all of her like blood circulating changes and focuses on a new spot. Same thing happens like if you're like deep in thought, or when you're sleeping, your blood flow is or when you're digesting, like your blood will shift and like be in a different pool, in a greater circuit in a different area, and that like will change your magnetic and electromagnetic fields. So like, say like same thing with like a pregnancy, like that whole magnetic field is being changed. So I think like male and female right now, there's something beyond happening, beyond just like a woman's menstruation, or your thinking and blood's being diverted to your brain. Maybe it's more like that, like this bigger consciousness is happening for a set amount of people that made certain choices, that maybe there's a new part of our body that's being circulated, but there's like a dramatic shift in our magnetic fields, and that is repulsing the parasitic foreign bodies that have been embedded in our temple. I've noticed a big reduction in the amount of Morgellons fibers over time. I still get them here and there. It's usually in like deep like folds. But yeah, like in 2017, 18, it was like a lot of shedding. But that's what I think. Epsom salt. Stuck in the body for real. Yeah. Yeah, and I think also like, see, you can see it. Like, I don't know if it's always been like this, but the way our hair grows around our ears, like if you try to pinch the skin like right in front of your ear, like can you pinch it off your head? And if you can, like where are the hair follicles coming from? You'll kind of see that like a lot of your hair follicles are like tucked in like a permanent direction from like going behind your ear, and then it like pulls your scalp in this like dented way, and you can kind of massage your scalp and your face in a way that you can feel that you can like lift your hair follicles and almost like recomb it, but like it's kind of tied to the Morgellons, but it's like a hair pattern of growth where our hair is kind of like like crop circles where they fold the wheat over on itself. Like that's how like my hair grows, like right here. Like it's really hard to just like separate it like at the scalp, like so it's like this like woven pattern of growth that it's like once you kind of try to separate those actual individual follicles to the root and then like comb them, there's like this release that happens, and it's like it's like around your ear. It's like the hair wants to grow like around, and then like the tips like want to go back in to the inside of your ear, and like you'll see like if your hair is long enough, you'll have like these hairs that have grown like this way around the base of your ear, and then like the tips will go back in, and you'll be like, what the fuck? Like I have like this hair that's like growing in like this swirly knot, and you just like are brushing the ends of your hair. But it like, these are my struggles. Yeah, a lot of people, they can never, and I worked at Bosley. I did hair transplants on people, surgical hair transplants. And some people's scalp, they're so taut and pulled. Like I've noticed on people this like taut, pulled swirl, especially on this side of the head. And I personally try to, like, I spend time trying to work it out. But our hair is like cemented grown like this way, instead of just growing like straight off of your head. It's like cemented growing like this way behind your ear, because we've always been like going like this or maybe our moms like always brushed our hair like this, and like it like constricts the expansion of the sides of your face, and it gives you like TMJ, like it makes the like it hard to like if you like spread your temples like this while you open your mouth, you'll feel like your hair kind of like move into different spots. I know, and anytime, and this happened at Bosley too, anytime you talk about your hair, people think you're crazy. Anytime. And it was, like, I never had that judgment on my patients working at Bosley, but they would tell me, you know, like, oh, we got our patients that pull out their hair. It's called trichomatosis. But you get somebody talking about their hair, and it's like this mind control. You automatically, you don't want to listen to them talk about their hair. Like, you don't want to listen to them like, oh, and I have like, there's something happening here, and then my eyebrows, I have a little bit of thinning here. Like I worked at a hair transplant place, and I would watch people like nurses like turn off like listening to a patient talk about their hair. Like, it's like you automatically put them in the crazy chair. And that's why like a lot of men, they never want to talk about being bald. Like, there's this huge shame around it, and it's like tied to being crazy. It's so emotional. But a lot of the bald men, they were bald like simply just kind of from neglecting their scalp. Like, people are so worried about losing hair that they'll stop like massaging their scalp, and they'll build up like these keratin like plaques, and you could just like shift, like do this on their head, and look at all this like crinkle like skin and like hairs falling out and stuff. It's like, do you ever like shampoo your hair? And it's like, oh, well, I just lightly, you know, they're so worried about their hair falling out. It's like they don't actually like clean their scalp or like exfoliate. And it's like, you need to get oxygen. You need those like I don't know if it's part of the Morgellons, but there's something like I think it's part of the shampoo that we use. We're like constantly stripping our hairs of the natural oils. So especially like with like Caucasian people, Asian people tend to have like a more like nourished follicle. Indian people have this dry kind of hair. African American people, they have a totally different follicle. It's a C-shaped follicle that grows up kind of like this. But like Caucasian people, like it's like our hair wants, it's like static too, but it wants to like grow and stick together, especially at the base. And then it, like you get this like anoxic environment in your scalp where the hairs have kind of grown together so long and never been separated at the base. It's like the scalp kind of grows this kind of like keratin plug, and it's like until you actually get down there and like separate those stalks of wheat, can you like open up those pores and like get the oil flowing back in, and then like it will kind of plump out. And like, I don't know, it's it has to do with the chemicals in the air. It has to do with the chemicals, the soaps that we put on. It has to do with the water that we wash our hair with. Yeah, but I think the ultimate thing, it's messing, like, we're supposed to have like this nice, like insulated, like I just put conditioner in my hair when I take a shower. I don't shampoo it because I don't want to alcohol strip it. But yeah, even like my hair doesn't get oily. Like it doesn't, my hair used to get really, really oily when I had long hair. But I think naturally we're supposed to have these like lubricated, and like you're really supposed to be getting in your scalp. Like if you really get in there, there's like dents. Like, and then you like try to spread those dents apart, or try to like pinch up the skin and tent it, you'll get this like mat of hair. Like, oh wait, this hair doesn't even like originate from this spot. Like this hair like originates like all the way behind my head. Like, why is it popping up here? It's because my hair is like growing. It's odd. It's a weird, it has to do with like the magnetics and But anytime you talk about it, you sound crazy. That's the thing. Like even if you're like, oh, go to a hairdressers don't want to hear you talk about your hair. They do not want to hear you talk about and like showing you, like people think you're like trying to show them like lice or something. Like people like think that like you're trying to show them something that's invisible, and then they'll be like, okay, we'll take care of you. No. But I've noticed it. It's like people don't really care about their own hair growth, like their pattern. But it's almost like on everybody, like especially around the ear. Like you try to pinch the skin behind your ear, you'll get like a bunch of hair, and then you try to like comb that hair out. That hair doesn't come from behind your ear. It comes from somewhere else on your head, and it's like, yeah, just try to pinch your skin in opposite ways. Like instead of pinching it this, like instead of pinching your skin this way, pinch it up and down ways. And then you'll get like weird, you're like, wait a minute. It's like our hair is growing in ways to constrict our skin. Like some people, they have hairs that grow like from this side all the way over, and then they tuck it, like it's invisible, and it'll get like embedded in a wrinkle, right? And then over time they'll get this pull of their skin, and they'll have this like shiny pull and almost like a dent in their head. And it's like only if they really worked on, see, like I even have it, if they really worked on working out the dents and the peaks and the valleys of their scalp, you'd get rid of those shiny, weird, it's like the baby hairs get like swirly matted and it goes into your eyebrows. But yeah, anytime you talk about this, you look like a crazy person. But you'll see it. You'll see it on like enlightened people. Even have like long hair. They have this like weird like bald swirl. Like that redhead guy who does the hi guys, I'm a liberal. I'm gonna tell you about, like he does like the comedy. He has like frizzy red hair and a red beard, and he lives in LA. Or I think he might have moved. It's JT. He is getting it too. Like this, like it's like this matted, like it will start to look bald, but it has to do with like the hair growth and not like combing your hair out from the root. Just like, and it has to do with like the hair growth growing behind the ears, and Lori Ladd has it. Like, I mean, I even have it too, but I've worked it out over the years. That's part of the reason why I shaved my head, was like to restart the follicles so they had like freedom. But the path of your scalp is so like grows like this. So like it's really easy for them to get tangled up on themselves, especially if you have fine hair, and then that tangle turns into a wrinkle, like, and then it starts to like, the hairs start to grow in on themselves, and then that develops into an actual wrinkle in your skin, because it like, the follicles tent the skin in. Like I kind of learned that, like sewing people up, you have to be very careful of the pattern of the follicles, because if you sew up two ends of skin and the follicles are going in different directions, you're gonna get this, first of all, the scar is not gonna heal correctly. You're gonna get hairs growing into the scar, and you're gonna get this like weird cowlick. You're gonna get a weird pull on the skin. You have to like make sure, like the pattern of the carpet is matched up correctly, the weave. And a lot of our scalps like are woven really funky, especially at the temples. Right here, like just rub your temples right here, like really hard on this top of your skull, like feel your skull right here, like there's dents, and it's like, can you pinch your skin right there off the top of your skull? Probably not. It's probably the skin on your skull right here is so tight that, but when you start playing with that, you'll notice that your hair, I don't know, I think guys are a little different because they always have short hairstyles and they're always like combing from the root. But yeah, women, like, oh, got the weird pattern hair growth. JP shares, I think most of the problems with skin come from having pig, cow, and chicken fat in their bodies and blood streams. like from eating it. Cradle cap. I scrub my scalp with my nails or scratch. Yeah, good, Virginia. More jello. I didn't believe it was internal stitch work. It's weighted on my stomach. Yeah. It takes years to push out sutures, but your body will do it. I've seen it. Like I would have old elderly people come in with like surgical scars from like decades ago, and they're like, I have a pimple, and I'd be like, what is like this thing? Like, oh, that was a scar from a lipoma I had removed or something. And then you take a piece of tweezers, and it's like an actual old suture. Like, ooh, they left one behind. That happens a lot in gynecological procedures too. So much stuff gets left behind, sutures and stitch it. Like I was in a procedure, a gynecological procedure, where they were doing a bladder lift, a mesh lift for urinary incontinence. So they were doing it up through the vagina, and they were up in there, and they had this special suture device that it was like, it looked like a long fishing hook, and it had a trigger, and you'd stick it up, and then you pull the trigger, and it would throw the stitch, it'd put the needle in the skin, and then the device would catch the needle in the tip so that you could pull it back, and then you could have the needle end and tie your knot, so you didn't have to like have a forceps up there to pinch the needle and get it after you threw the stitch. So because this was doing a procedure through the vagina up inside like a teeny tiny little pocket. It's not a good way to do surgery. These things fail all the time, problems. Anyways, so I was I was in the surgery, and the thing broke. He did it, and it broke, and the needle broke off up inside of this woman. It was like, it's not like it was like an open wound and you could fish it out. It was like up inside the folds. Like he was doing it blindly, and he's like, it broke, and I'm like, oh. He spent about half an hour trying to like dig it out, the piece of needle up inside of her vagina, but he couldn't get it. It was up in there, and he's like, well, I'll have to tell her when I wake her up, and that stuff happens all the time. So hopefully she worked that needle out. Oh, me red vision. What's the other day from what? I talk about that at the beginning of the video. I think it's a computer generated image. This is the essential. What's that? I don't know what that is. Look up one more thing. Sheephead ocean sea hunter syndrome. Right here, facial paralysis, 186. This one's everybody's go-to book. So this is old information, 2009, current medical diagnoses and treatment, Lang. This is like a highly regarded source that most medical schools use. I lost my spot. Where am I going? Okay. Facial paralysis. So this is listed under this. I don't know if you see that header there. Otologic manifestations of blank. I'll just get to where it talks about Bieber's problems. In cases of progressive hearing loss, it is important to evaluate for cryptococcal meningitis and syphilis. Acute facial paralysis due to herpes zoster infection, which is called the ram like a sheep sees ocean hunter syndrome, is quite common and follows a clinical course similar to that of similar to that in non-immunocompromised people. Treatment is primarily with high-dose acyclovir. All right, listen to this one. So usually there's an eruption at the same time of blisters, like really painful blisters in the ear, that you have this problem. It's not like a perfectly symmetrical face. 12-11. Lesions on the tip of the nose, inner corner of the eye and root, and side of the nose, which is a Hutchinson sign, indicate involvement of the trigeminal nerve, which is called herpes zoster ophthalmicus. Facial palsy, lesions of the external ear with or without tympanic membrane involvement, which is the eardrum. Vertigo and tinnitus, that's vertigo is when you feel like the room is spinning, or you feel like you're gonna fall off like a skyscraper. And tinnitus, that's ringing in the ears. A lot of people call it tinnitus, but it's tinnitus. Tinnitus and deafness signify geniculate ganglion involvement, which is called sheep like a ram, like a sheep, sea like an ocean, and then hunt like a hunter. So you need all of those. You need the facial paralysis. You need lesions, like actual active, like your ear is like blow up nasty. And it's usually on the eardrum. So like you have like a horrible earache with the actual blisters on the ear. So it's like so swollen that your face is like swollen out. So you need all of that. Usually you're deaf. You're vomiting. So I don't know, that computer image kind of looked like it was just blinking funny to me. I don't know, it didn't look like anybody that I've seen with those types of problems. Like people with those types of problems, they're really, really sick people. Like they look bad. Like their face is nasty looking. They look like Quasimodo. Like they look like, you know, in James Bond or whatever, they like inject half their face with like the ugly stick, like to disguise themselves, like they're like beautiful, and then they have like the James Bond like injection, and like they're like this. Like that's what people look like when they have this syndrome that Beeb's computer generated Instagram image says it has. They're like this, and then they're like, they have like sunglasses, and they're like taking the sunglasses and putting eye drops, and they like usually have like a visor on. It's not good. And not a good look. All right, guys, I think I said my piece. These are only books. I'm only a person. Love you all.